On this video, I'm going to discuss pleural effusion to the T. If you want to know more about that, stay tuned.
Choose your fighter.
Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that. Subscribe now, hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Hi everybody! Yes, isang panibagong week nga ng discussion ng alay ko sa inyo ngayon. Kagaya ng pinangako ko sa inyo last week, kung hindi mo pa napapanood yung video na yon, where I created board exam type of questions sa Psych 5 natin, PNLE 5, panoorin mo yun. But nagbabalik ako para sa isang panibagong discussion. This time, I'm gonna give you a thorough discussion about your pleural effusion. Medical surgical nursing topic nga po. Medical surgical nursing ang alay ko sa inyo for this week. Today, I'm gonna give you everything you need to know when it comes to your pleural effusion. I'm gonna be discussing what is the clinical definition of your pleural effusion, clinical manifestation, diagnostic findings, general management, pharmacological treatment, surgical management, and of course, your nursing intervention. Now, kung hindi mo pa napapanood yung ibang mga nursing, medical surgical nursing topic na create ko, i-click ko yung description box. Ilalagay ko yung link doon sa baba. I-click mo lang yung link na yon ng playlist and also other playlist. The other playlist I created for nursing education. Or kapag nagpapaut itong icon button dito, just click the one out and I'm gonna be linking all the playlist in there. And also, before we further proceed with the topic, thank you so much nga po. Pa 12K na tayo. Maraming salamat po. Thank you so much for making that happen. Kung hindi ka pa part ng ating Facebook page, ililink ko yung link dyan. Please join the team, join the club because nagpo-post din po ako doon and I would really would like to hear from you guys. So without further ado, nurses, medyo mahaba itong discussion na to. Let me switch back to my PC and I'll see you guys in a bit.
Hi everyone, welcome back sa ating formal discussion ng yung pleural effusion nursing care management. This is another lecture material natin na idadagdag natin sa ating medical surgical nursing playlist. O nga po, kung hindi nyo pa napapanood yung ibang other medical surgical nursing topic na create ko, pakiclick lang po yung description box kasi ilalagay ko yung actual link dyan sa baba, or kapag nagpop up yung icon button, just simply click that one out because I'll be putting also the actual playlist including the other playlist I have on my channel. Now, without further ado, you guys, simulan na natin to. Let me share to you our objectives for today. So for today, we're going to discuss what is pleural effusion. I'm gonna make sure at the end of this video, you guys, you'll be able to have a clear definition on what is pleural effusion. I'm gonna also give you the causes, classification, clinical manifestations, diagnostic findings, medical management, surgical management, and of course, this will not be a nursing lecture kung hindi natin tatalakayin ang iyong nursing management. So hinga-hinga, medyo mahaba po ito. Ready ka na ba? Let's begin. First up, what is pleural effusion nga, guys? So let's define this one muna. So it is a collection of fluid in the pleural space of the lungs. Fluid normally resides in the pleural space and acts as lubricant for the pleural membranes to slide across one another when we breathe. So fluid constantly being added and reabsorbed by capillaries and lymph vessels in the pleura. Bakit ba parang nabubulol pa ako? When this recycling process is interrupted, a pleural effusion can result. Now, just to add it on the definition, you guys. So like I said, fluid accumulation between the visceral and the parietal pleura of the lung that is possibly extracellular fluid. Pus, emphyema, blood hemothorax, cele or xylothorax or bile results from excess fluid production or decreased lymphatic absorption. Yung pleural effusion nga po, which is tatalakay natin sa mga susunod, is classified into three. So, wag kayong mag-alala dahil ibibigay ko yan sa inyo. Handa na ba kayo? Ayan na. So, that is just a short medical description of your pleural effusion, ha? Now next, what are the causes and classification? Now the way we will discuss this is by giving you the classification with their possible causes for each type of pleural effusion. Now, because there is actually different causes of pleural effusion. So I'm going to give you transudative pleural effusion, exudative or exudative pleural effusion, and emphyema. Handa ka na ba? Handa na. Of course, nurses. Okay, ilabas na ang mga lapis at ballpen dahil ito na talaga. Mag-notes kayo, ha? So, transudative pleural effusion, that's our first classification. Now, this is caused by fluid leaking in the pleural space. This is from increased pressure in the blood vessels or a low blood protein count. Heart failure is the most common cause. So, pag sinabing caused by fluid leaking into the pleural space, nagli-leak yung fluid doon sa pleural space mismo, that is your transudative or transudative pleural effusion. Now, an effusion is execudative if it meets any of the following three criteria. Una, nurses, the ratio of the pleural fluid protein to serum protein is what? Greater than 0.5. Pangalawang criteria, pleural fluid lactate dehydrogenase or yung tinatawag nating LDH to serum LDH ratio is greater than 0.6. Yung pangatlong criteria, matatawag mo siyang exudative pleural effusion if the pleural fluid LDH is greater than 2/3 of the upper limit of a normal. So may mga criteria, normally ratio and range para ma-differentiate mo yung transudative and exudative pleural effusion. Yung pleural effusion, transudative siya kapag may leaking into the pleural space. Kapag exudative, huwag malilito ha, the ratio of the pleural fluid, unang criteria, fluid protein to the serum protein is greater than 0.5. Tapos, pag-uusapan mo rin dyan yung LDH ratio na 0.6. Okay, yung LDH lactate dehydrogenase 0.6. Yung pangatlong criteria, yung pleural fluid daw niya is LDH is greater than 2/3 of the upper limit of normal. So, wag malilito. Now, meron pa tayong isa, emphyema. Now, emphyema is also called phyothorax or purulent pleuritis. Emphyema, ano po mapasok sa isip nyo? Pus. Okay, now it's a condition in which pus gathers in the area between the lungs and the inner surface of the chest wall. Now this area is known as the pleural space. Pus is a fluid that filled with immune cells, dead cells, and bacteria, diba? White blood cells. Now, let's definition ng terms na tayo dito kasi medyo may naririnig mo to madalasan sa discussion na to, ha? Exudate. Pag sinabing exudate, a mass of cells and fluid that has seeped out of blood vessels or an organ, especially in inflammation process. To distinguish exudates from transudates, if the patient's serum total protein is normal and the pleural fluid protein is less than 25 grams per liter, the fluid is transudate. If the pleural fluid protein is greater than 35 grams per liter, the fluid is an exudate. So again, those are just the classification of your pleural effusion. Tatlo po sila. Malinaw yon? Malinaw. Now, para mas lalo mo maunawaan, ibibigay ko sa iyo yung causes per each type of classification. Again, naalala mo yung identify natin siya kanina, ha? So, ito yung mga causes ng transudative pleural effusion. Una na dyan yung cardiovascular disease, hepatic disease, or cirrhosis. Transudative pleural effusion can only be because of hypoproteinemia. Remember, decreased protein level in the blood. Pulmonary embolism, PE. And open heart cardiac surgery. So these are, once again, the causes of your transudative pleural effusion. Kapag ang pasyente mo na-diagnose na merong transudative pleural effusion, ito yung mga posibleng causes niya. Okay ba yon? Okay. Now next, exudative pleural effusion. So these are the causes of your exudative pleural effusion. Una, yung pleural infection. Pangalawa, you have your pleural inflammation, and you have your pleural malignancy, which is common in breast cancer, pneumonia, pulmonary embolism, pancreatitis, kidney disease, inflammatory disease, What are the types of your inflammatory disease? Example natin dyan, allergy, asthma, autoimmune diseases, celiac disease, glomerulonephritis, naalala mo itis, glomerulonephritis, hepatitis, inflammatory bowel disease, and pre-perfusion injury and transplant rejection. You also have your drug use, tuberculosis, and your asbestos exposure. Actually, hindi ko nalagay dito yung trauma, pero kasama pa rin yun sa causes ng iyong exudative pleural effusion. So once again, these are the causes of your exudative pleural effusion. Next, emphysema, pus, yan ang unang papasok sa utak mo, okay? Infected wound, intra-abdominal infection, lung abscess, pulmonary infection, thoracic surgery, malignancy, mga cancer, connective tissue diseases. Ano yung mga examples? Good examples ng connective tissue diseases mo. You have your rheumatoid arthritis and scleroderma and lupus, mga autoimmune diseases. Okay, so once again, these are the causes of your emphysema. So, clinical manifestations nga po. Ano nga ba ang clinical presentation ng iyong pleural effusion? Yan ang tatalakayin natin sa mga susunod na slides. Okay, nakakasunod pa ba guys? Mabilis lang to. Ibibigay ko lang sa inyo yung mga signs and symptoms niya. Una, merong dyspnea, hirap sa paghinga. Natural kasi may tubig sa bagay yan guys. Hindi na nakaka-expand na masyadong normally yung lungs kasi merong na-occupy ng fluid yung part na dapat ay merong air. Part na dapat na may air para sa gas exchange. So, posible bang may hirap sa paghinga ang pasyente mo? Definitely. You also have your fever and chills. Bakit may fever and chills? Signs of inflammation and also signs of infection. Trachea, mediastinum, or both deviating away from the affected side. Bakit nagde-deviate? Kasi na-occupy ng water or fluid or pus yung area which pushes the trachea away. Kaya magpapasin mo may tracheal deviation and mediastinum deviation. Papunta saan? Sa unaffected o dun sa affected side. Dullness and decreased tactile fremitus over the effusion. Kapag pinalpate mo yan at inassess mo ang lungs ng pasyente mo, may dullness and decreased tactile fremitus over the effusion. Next, diminished or absent breath sounds using your stethoscope, bronchial breath sounds. Wala ka na maririnig dyan. Walang papasok na hangin doon sa part ng baga ng pasyente mo na merong tubig. Next, tachypnea. Tachypnea meaning rapid breathing. What is your normal breathing? The normal range? It is 12 to 20 cycles per minute. What else? You have cough. May coughing din dyan. Bronchial breathing or egophony. And then hemoptysis, pag ubo ng may kasamang dugo. Pleural friction rub. You also have your peripheral edema, distended neck veins, and S3 gallop, and foul-smelling sputum. Okay, common to sa mga may emphysema. Next, diagnostic findings. Now, when it comes to diagnostic findings, I'm gonna give you 4 ways or 4 management on how are you going, not management, but more for diagnosis on how are we going to confirm pleural effusion. So, hinati ko siya sa 4. We have your labs, imaging, diagnostic procedures, and the other procedures that the doctor may order to your patient. The first one, tatalakay natin is laboratory. So, all about serum, blood extraction ito. You have your arterial blood gas analysis. So, ano nga ulit ang normal ABG mo? You have your normal, ang pH is 7.38 to 7.42. Oxygen saturation mo is 94 to 100%. That's your normal range. Bicarbonate, that's 22 to 28 milliequivalents per liter, mex per liter. Bakit kinukuha yung ABG mo? This is to evaluate oxygenation status ng pasyente mo. Again, we're talking about the lungs. Now, you have your pleural fluid analysis. Now, sa pleural fluid analysis mo, malalaman mo, ganito niya i-analyze or i-differentiate kung anong klase ba, anong classification ng pleural effusion mo. So meron kang with transsudative effusion, specific gravity is below 1.015 and less than 3 grams per deciliter of protein present. So kapag present itong mga numbers na to, itong mga numerics na to, that could be transsudative effusion. When you talk about exudative effusion, the ratio of protein in serum is 0.5 or higher. The lactate dehydrogenase LD level is 200 IU, International Unit of higher, and the ratio of LD in pleural fluid to LD in serum is 0.6 or higher. When you talk about emphysema, microorganisms are present kasi nga may pus. The WBC count is increased. Fluid is frankly purulent. May pus, purulent. With esophageal rupture or pancreatitis, itong lalabas sa pleural fluid analysis mo. Fluid is present with amylase levels exceed serum amylase levels. So we're talking about your amylase. Once again, these are your laboratories. Then we have your imaging. Siyempre, meron dyang chest x-ray, chest radiography. Now, may show pleural effusions. Lateral decubitus films may show loculated pleural effusion or small pleural effusions not visible on standard chest radiography. You also have your CT scan, computed tomography scanning of the thorax. Ano yung papakita sa'yo nito? Shows pleural effusions kung saang side and yung gano'n na ka-massive yung fluid sa lungs ng pasyente mo. Now, you also have your transthoracic ultrasonography, which reveals what? The amount and the level of fluid accumulation. Kung gano'n na ba karami yan to 1,000 cc na ba yan, saang side, and anong level na. Okay, so once again, these are your imaging confirmatory test of your pleural effusion. When it comes to the other diagnostic procedures, you'll have there your thoracentesis. Very good, nurses. This will obtain pleural fluid specimens for analysis to aid in diagnosis. Kaya gagawin mo yung pleural fluid analysis, magto-thoracentesis ka muna. That is the procedure. Malinaw ba sa inyo yon? Malinaw. Meron din tayong mga other test. Tuberculin skin test. Bakit? Maybe positive for TB. Kasi 'di ba sa tuberculosis, ang isa sa mga manifestations niya is fluid in the lungs too. Lalo kapag napabayaan sa latter part. You also have your pleural biopsy. This may be to indicate or to rule out carcinoma or malignancy. Malinaw yon? Malinaw. Proceed na tayo, nurses. Medical management nga po ng iyong pleural effusion. So, the way I divide this is by 4 categories. General treatment, diet, activity, and pharmacologic treatment. Handa na ba kayo? Handa na. Eto na. Hinga-hinga. Hinga lang ako. You have your thoracentesis. Bakit? Bakit siya gagawin? Bakit may thoracentesis? This is to remove fluid. You have your chest tube insertion. This is indicative for large effusions. Chemical pleurodesis indicated for recurrent pleural effusion. Kapag paulit-ulit na yung pleural fluid ng iyong pasyente, you will gonna do not thoracentesis but most likely chest tube insertion na tayo. Now, you have your intrapleural fibrinolytic agents. This is for in limited cases ng yung pleural effusion. And also, the way you're going to manage it in general is treatment of underlying condition. If it's caused by malignancy, if it's caused by, TB, tuberculosis, or trauma, iti-treat yung underlying cause. Otherwise, magre-recur ang iyong pleural effusion. You also have your venous thromboembolism, VTE prophylaxis if the patient is hospitalized. Mga inpatient ito. Kasi naalala mo, isa sa mga causes ng iyong transudative pleural effusion is PE, pulmonary embolism. Malinaw ba sa inyo yung general treatment? Malinaw. Now, when it comes to diet and activity, ano kaya ang papakain mo sa pasyente mo? Siyempre, high calorie. You also have your activities. In terms of activity naman, as tolerated. Kung ano yung kaya ng pasyente mo, kung kaya niyang minimal walking, kung kaya niyang mag-climb the stairs or to do some moderate exercises, as long as na hindi mahahapo yung pasyente mo kasi that could be really difficult for your patient. Next, you have your pharmacologic treatment. Pharma nurses. Nako, ito na. Favorite nyo to. Sent you a bouquet, take my troubles away, then you know I'm the first to say. First one, you have your Antimicrobial therapy. Sa antimicrobial therapy, this good example of this is ampicillin sodium sulbactam. Ito siya, oh. Yes, clindamycin, imipenem-celestine sodium, nasabi ko na yung clindamycin phosphate injection or piperacillin tazocine sodium tazobactam based on the causative organism. May antibiotic po ito. Next, you have your slurry of doxycycline, bleomycin sulfate, or TOG. Para saan naman to? Bakit ginagamit? Anong indication ng gamot na ito for recurrent pleural effusion? You have your chemotherapy to treat malignancy. You have your corticosteroids and non-steroidal. Okay, so next you have your corticosteroids. Corticosteroids and NSAIDs nga po, inflammatory drugs for effusions due to rheumatologic or inflammatory causes. Alright, so you also have there your diuretics. Bakit nag-administer ng diuretics such as furosemide or fusions? This could be because of the heart failure and ascites. Remember, one of the causes siya. So kapag nagbigay ng diuretics, it could be the causes is due to heart failure, probably, and ascites. You also have your oxygen therapy and IV fluid therapy. Malinaw ba sa inyo yon? Malinaw. So once again, these are the pharmacologic treatment of your pleural effusion. Now, when it comes to surgical management naman, ito na nga siya, nurses. Handa na ba? Handa na. So, the next one is, in terms of surgical management, you have your thoracoscopy. Copy, meaning visualization. So, thoracoscopy or video-assisted thoracoscopic surgery may be needed to confirm diagnosis when thoracentesis or pleural biopsy has not been conclusive. You have your tube thoracoscopy. Also, you have your pleuroperitoneal shunts. Now, this could be very rare for recurrent pleural effusion. Pleurodesis, chemical or mechanical sclerosing agents administered by video-assisted thoracoscopic surgery. You have your pleurectomy. Ectomy, may i-remove. So, radical, total, or subtotal, and decortication for malignant effusions. You have your insertion of long-term tunneled indwelling pleural catheter to allow what? For outpatient management with recurrent effusion. So kapag paulit-ulit ang pasyente mo at ayaw ng pasyente mo maging inpatient, maaaring indicative ang iyong long-term tunneled indwelling pleural catheter. So bit niya yung catheter niya. Next, you have your thoracotomy to remove fibrous tissue and infection. Once again, these are the surgical management. Naku, nasa last part na nga po tayo. Ito na ang yung pinakihihintay na nursing management. So sa nursing management natin, nurses, ginawa ko siyang ano ba yung mga nursing intervention natin, nursing considerations natin when it comes to your pleural effusions if your patient is diagnosed with this type of condition. Eto na, iisa-isahin ko talaga sa inyo literal. You have your administer prescribed drugs and IV fluids, initiate IV access, and maintain IV patency. This will provide IV site care, or nurses should also provide IV site care according to facility protocol. Next, you have your give supplemental oxygen therapy based on oxygen saturation levels and ABG gas result. Next, you have your assess the patient's skin and mucous membranes for evidence of hydration. Obtain daily weight as indicated. Kasi nga may weight loss ito. May weight loss ito ang pleural effusion. Naku, napakalapit nga po nitong, napaka-close to my heart nitong disease na to kasi ito ang currently diagnosis ng aking nanay. So recently na-diagnose siya ng may pleural effusion and she is still undergoing the treatment. So I really decided to create this topic just for her to learn her condition or sa mga pasyente natin dyan o sa mga nurses natin dyan nagte-take care ng pasyente nilang diagnosis is pleural effusion. So this could be a really good reference for you. And also for me na rin para ma-refresh yung knowledge ko. Next, ensure a patent airway. Nako, yung mga blockage sa ating airway na yan, sa nose, sa mouth, kung saan dumadaan ng hangin. Now, how are you going to do that to your patient? Encourage coughing and diaphragmatic breathing exercises and frequent use of incentive spirometry. So, nakavulday na mga pasyenteng ito. To what? The rationale is to increase the lung capacity. Now, prepare the patient and family for chest tube insertion or thoracentesis. Kasi napakalaking fear nga ito para sa mga pasyente natin. Yung anxiety level nila nag-i-increase. Nako, kitang-kita ko to sa nanay ko, okay, mag-alala. Next, assist during thoracentesis. So you prepare the family and the patient, you provide your nursing education, and on the actual procedure, you're going to assist in the thoracentesis process. Now, assist with the insertion of chest tube if indicated. Provide meticulous chest tube care and ensure chest tube patency. Provide for frequent rest periods. Importante nga po, kasi paghahapo, isa sa mga clinical manifestation ng yung pleural effusion. Assist with care when needed and cluster activities to minimize energy expenditure and oxygen demand. Apply anti-embolism stockings or sequential compression stockings to prevent what? VTE, venous thromboembolism. Kaya nga 'di ba naka-inoksa pa rin ang mga pasyente mong may pleural effusion just to prevent PE. Elevate the head of the bed at least 30 degrees to maximize chest expansion and ease the work of breathing. Semi-Fowler's position nga. Allow patient to verbalize any feelings and concerns related to the condition. Provide emotional support. This is to elevate anxiety. Assist the patient with relaxation measures to reduce oxygen demand. Model positive coping strategy. Obtain specimens for laboratory testing, such as serum electrolyte levels if the patient is receiving diuretic therapy. Screen for and assess the patient's pain using facility-defined criteria that are consistent with the patient's age, condition, and ability to understand. Treat the patient's pain management as needed and ordered using non-pharmacologic and pharmacologic or combination of approaches. Monitor closely if the patient is at high risk for adverse outcomes related to opioid treatment if prescribed. So kapag ang pasyente mo nagpe-prescribe ng opioids, i-monitor closely mo siya for adverse effects. Yun lang yon. Next, reassess and respond to the patient's pain by evaluating the response to treatment and progress toward pain management goals. Okay, so kung nag-assess ka ng pain, meron kang reassessment ng pain pagkatapos ng iyong non-pharmacologic and pharmacologic treatment or intervention. Yay! Yun na nga po, nurses. Thank you so much for watching. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga po yung next video natin next week regarding sa other mga nursing topics. I-comment nyo kung anong gusto nyong makita next week. Igagawin natin yan, okay? Now, if you haven't watched the other playlist I created, and if you haven't subscribed, pangpalaki charm, pangpalaki ngayong darating, ngayong 2020, mag-subscribe ka na. Tulungan mo na nga ako. Ipamalita mo na sa Radyong Sira ang pinakabago, ang pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next time.
Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. Hashtag Team Kulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I will also like to invite you to please join the Facebook page. The link is on the description box. Alright, and I'll see you again next time.